In this video, I'm going to show you how you use the Playmaker or Hypervolt to massage the gastroc and soleus muscle in the leg here. This is going to be really important if you're dealing with any calf problems, any Achilles tendonitis or plantar fasciitis problems. So we're going to use two techniques to help release that gastroc and soleus muscle. The first way is we're going to do it statically to the muscle. So what we're going to do is we're going to turn on the Playmaker, we're going to turn it on level 3. And what we're going to do is we're going to work that massager right along the back edge of the bone here called the tibia. And again, we don't want to do it right on the bone. What we want to do is we want to go up and down this gastroc and soleus, finding any of these tender trigger points or knots, and just go up and down the leg here, just with the leg in a static position there. And again, focus on those areas, go back and forth 10 or 20 times. Definitely concentrate on this inside portion of the calf, and then what I want you to do is then I want you to transition to the posterior portion and go up and down that gastroc and soleus in the back as well. But the inside portion will give you the most amount of relief and help with those other conditions as well. The next way we're going to use the Playmaker on the gastroc and soleus is we're going to add some active motion. So what we're going to have the patient do is she's going to straighten her leg, and what she's going to do is she's going to put her foot through a range of motion while we're doing this technique. So she's going to go back and forth like that, dorsiflexing and plantar flexing her leg. And what that's going to allow me to do is to get deeper into the gastroc and soleus. So again, what we're going to do is we're going to demonstrate this here. Go ahead and put that through a range of motion. And again, you're going to have to go lighter with this one because you're going in deeper with putting the muscle through a range of motion. But again, a lot of times you'll get more of a release when you're doing this technique. So that is how you apply the Playmaker to the gastroc and soleus muscle in the calf. To apply the Playmaker to the quadricep, what we're going to do is we're going to do it in a static position first, and then we're going to add some active motion to it. So the first position we're going to do, we're just going to have the leg down like this. We're going to put it on level 3. And what we want to do is we're going to start at the top of the quadricep right here, right off her pelvis. And we're going to work down right above the knee. So we're just going to kind of go back and forth. And again, if you feel a tender spot or a knot, you're just going to focus in on that area for 10 to 20 times and then move to the next. And when we get closer to the knee, you don't want to do it right on the kneecap. You want to do it right above the knee and not get on the kneecap because that'll just feel very uncomfortable. And again, start in the center section of the quadricep and then just go back and forth. The next area you want to hit is in this inside portion of the quadricep. So we'll just bring it to the inside portion. Maybe a little bit more sensitive in here, so you may have to back off the pressure a little bit on the quadricep. Good. And then what we're going to do finally is we're going to work the outside portion, so the lateral portion of the quadricep and IT band. So very important for a lot of people. This is a big area where people have knots or trigger points, so you're going to really want to focus a lot of time and effort right in this area here. And so again, we're going to work more in this in-between position between the quad and IT band and focus in on any areas that are really tight right here. And then I want to go more lateral and go more on the IT band as well. And again, you want to stop right above the knee. You don't want to do it over any bony sections there. So that is how you would apply it to the quadricep. To apply the Playmaker to the hip and glute region, what we're going to do is we're going to have the person lay in a side position. You can either do it in a sideline position or laying on their stomach. I like to do it in this position because then we can just transition right to the active motion portion after this. So what we're going to do is we're going to turn it on level 3. We're going to find this bony section. This is called the greater trochanter. And from that area back towards the tailbone area, there's the glutes and all the hip rotating muscles, and that's where we're going to kind of concentrate. So we're going to go from that bony section and not do it right on the bony section, but just come just lateral to that and just the edge of that, and then work more towards the posterior side. So we're going to just, again, statically just do it and move the actual Playmaker over the area. This is a tender area for a lot of people because we sit all day long and we don't stretch this area enough. So when you get in this area, you're going to feel some trigger points and knots in this area, and just kind of concentrate on any of those tender areas. It may be more lateral towards the greater trochanter or the bony area, or it may be more towards the tailbone. It just depends on where the problem area is. The other area you don't want to forget about is also up here. So this section right here between the top of the iliac crest, the pelvis, and then also that greater trochanter, there's a space in between here. And a lot of runners will often get really knotted up and tight right through this section. And you want to just work that area back and forth and go right in between those areas there. And this works great. Okay, so now we're going to add some active motion to it. So we're going to do the same thing, except we're going to have the patient bring her leg up off the side of the table in this case, or the bed at home. And what that's going to do, adding the active motion, is going to allow us to get a little bit deeper and a little bit more release. So let's have you bring your leg off the side of the table there and bring it back and hold for a few seconds, and then bring it back and bring it up, hold for a few seconds, and then bring it back and go. And when this technique, you can either hold it on a particular knot or trigger point if you feel it, or you can actually move it a little bit as she's doing it. The active motion will help to actually move the playmaker a little bit while you're holding it on an area. Good. And again, just same thing, make sure you work all areas, because depending on the patient, they may feel it in a different spot. And go again. The other great thing with this position is you can work the transition from the glute to the hamstring. So go ahead and bring that leg up. So if you're dealing with a high hamstring injury, we like to use this position because it gets in real deep for the hamstring. And again, come up and go from the hamstring right into the glute. And again, a lot of people, that's tight. To apply the playmaker to the hamstring, we're going to have the person get in a prone position, laying on their stomach. So we're going to do it in a static position first. So we're going to turn on level 3, and we're going to start at the upper portion of the hamstring right below the glute, and then go right down to the knee area. Again, we don't want to do it right over the bony section of the knees, but in this area there's a lot of muscle tissue, so you can work it pretty aggressively through that area. So we're going to start up here, and we're just going to go down the inside portion of the hamstring first. Again, any areas that are really tight, feel free to go back and forth on that area for about 10 to 20 times. There are two parts to the hamstring. There's an inside portion and then a lateral portion. It's going to help us decide where we want to place that playmaker, is on the inside or lateral portion. Also, don't forget to work in between the two muscle bellies. So I will also go right down the middle. And just be careful, because the sciatic nerve does sit right deep to this area as well. So if someone has sciatica, you got to be careful not to aggressively apply that right over the nerve as well. Also, while you're in this area, make sure to hit the upper hamstring right into the glute area. So again, depending on where that person is tight, you're going to want to apply it right through this section here. And again, go all the way down right into this section too. To add the active motion, what we're going to do is we're going to have the patient do a hamstring curl. So she's going to go through here, back and forth while I'm applying the playmaker, okay? So have you start here for me, and then go ahead and straighten the leg. Good, and then bring it back. Just do a little bit slower. Go ahead and hold. Good, and then bring it back. And do it again. Good, and a couple more. Go ahead, bring it straight. Good, and again, and you can relax. So that's how you would apply the playmaker to the hamstring region. To apply the playmaker to the lower back, what we're going to do is we're going to have the patient get in a prone position on their stomach, and what we're going to do is we're going to work not on the spine, but we're going to work just in the outside portion, about an inch or two off of the spine on both sides. And we're going to start all the way up from the mid-back region all the way down to the upper glute region. And we're just going to go back and forth on each side and making sure we're not contacting the spinous process itself. So we're going to avoid the spine. So what we're going to do is we're going to turn it on. We're going to turn it on level 3. And again, I like to start off with just the foam ball in this area and just work it back and forth on both sides. Again, if the patient is tight or you feel more tightness in one area, you can concentrate that ball in that section there. A lot of times this lower section right across the belt line area on a lot of people is very tight, stiff. And this upper glute section right below the belt line is also a really good area to work on most people because they're really stiff and tight. Now in this area, what you can also do is you can use the pronged attachment head, and you can go right next to the spine and go up and down. That gets a little bit closer to the spine. You just got to be careful not to, again, hit the spine process itself. It's not going to damage it or anything like that. It's just going to feel uncomfortable, and so you want to just avoid that. So that's how I would treat the lower back for this region there. For the upper back, what we're going to do, again, avoid the spine and avoid the shoulder blade, but anywhere from the upper trapezius along this scapular region right here is a really good area on a lot of people to treat. And so level 3, we're going to just work this area here. And what you're going to want to do is kind of follow the normal arc or curvature of this area here. So the scapula is going to kind of fall off the side of the rib cage here, and that's going to allow you to get into this rhomboid and upper trapezius area and just work this area like that. A lot of people have a lot of knots and trigger points from posture and sitting on a computer all day long. So definitely recommend you work this. And again, just avoid any of those bonier sections of the tissue. Again, I like to use the smaller foam ball for this one. You can also switch to the pronged one to work around the spine a little bit more closely. Just be careful with that. You can also use the cone tip on this one as well, and you can get in a little bit more specifically if they have one spot. Again, just be careful in this area because there is the rib underneath there, and you don't want to irritate that. Also, there's a nerve that runs right along the scapular border right here, and so just avoid that area if they're getting a sharp or shooting or burning type of pain. You want to just be real careful around that area there. You can also apply the playmaker in a seated position around the trap and shoulder blade area as well. And again, we want to avoid the spine and the scapula, but this is a great area because a lot of times people won't feel the knots or trigger points as much when they're laying down, but when they're in a seated position because of posture and gravity, you're going to feel those knots a little bit more, so you can kind of pinpoint where it needs to be placed. So we're going to put it on level 3. And again, we're going to work in this upper trap area and just work all along this scapular border. And you can see how I'm going more to like an angle around the scapula. You can see I'm outlining the scapular border right here with this, and these are areas where a lot of knots and trigger points will develop, like right through this section here. And you just want to work all right through this section here. Again, I would avoid this bonier section right there in the neck and cervical spine right there. Just work right to the edge of that and around it. And that works great. So that's how you would apply the playmaker to the upper back and neck area there. I highly recommend this in this area. This works great. To apply the playmaker to the shoulder, there's a couple positions you can get in, but one position I really like is just a seated position there. So what we're going to do is we're going to put it on level 3. We're going to use the smaller foam tip here. And what I'm going to have you do is I want you to put your left hand on your chest there, like opposite shoulder there. There you go. And what that does is it kind of spreads out this area here. And it also creates a window into what we call the shoulder capsule. So you can get it in a little deeper into the shoulder area and the rotator cuff. And so what we're going to do is we're going to kind of find any of these tender spots in the rotator cuff. And often you will find a couple really tender, sensitive spots right here. And this is all going to be really good in this section here. Good, relax your arm for me there. And again, do it in a couple different positions. So put the hand on the chest and then put it down right by your side and see if you feel more tension or tightness in one area there. And again, I'm not on the bonier area, I'm on more the muscular section in the shoulder area. So we're all right through here, and lat is gonna be a good area there. So now with this one, you can also do some active motion. So what we're gonna do is we're gonna actively kind of put the arm through range of motion while I'm working that rotator cuff. So what I want you to do is start with your arm here, and then what I want you to do, reach down past your right knee there and straighten the arm. So reach down across your body, good, and then bring it back. And again, I'm kind of focused on that back side of the shoulder there, and bring it back, and go ahead. And you can see I'm just having her do the motion. I'm not actually moving the playmaker, and that's gonna get deep into that rotator cuff and shoulder area. Good. And now let's have you come to a 90 position here, and then now I want you to just press straight up. So same thing, we're gonna kind of focus some areas, go ahead and reach up. Good. And again. Good. And now I want to go more in this armpit area here into the lat section as well. Good. And one more. Good. And you can relax. So that is how you would apply the playmaker to the shoulder, both in a static and then also a moving position there. If you have any questions, reach out to my office at 703-912-7822 or schedule online at novacarewellness.com.